Hey, yeah. So, do you want to try to make your positive case, and I'll refute it?
Sure. Okay. So first of all, we need to agree on the terminologies that we're going to use. As far as seen, apotemnophilia is like an outdated term. What is being used right now is body integrity identity disorder, which is defined as an overwhelming or obsessive desire to have one or more healthy body parts, and especially a limb, removed by amputation. Can we agree on that definition?
So I definitely agree that BIID is another term. I would see them
Hmm.
as slightly distinct. So, aptotemnophilia was coined by American sexologist John Money
Hmm.
in 1977 when he wrote about it as a sort of a sexual desire to have
Hmm.
one's limb removed. Now, um, I think BIID would see it as more of an identity issue where
Hmm.
you sort of see yourself as without this limb and you want it removed rather than like a sexual pathology. Um, but at least in my research, I've seen that you cannot remove the sexuality that's inherent with hidden identity. That sometimes you actually are are sort of turned on by the idea of yourself,
Hmm.
and identity is uh, not always distinct and separable from desire. But anyway, without getting into a sort of
Hmm.
a
Separate debate.
yeah a separate debate, I would say like we can maybe use both terms and say one is maybe a sexual desire, the philia, like to
Hmm.
have it removed, and the other is perhaps like an identity sort of thing. So if you want to argue from the standpoint of identity or the standpoint of like the sexual desire, I'd leave that to you in your argument. But let's maybe just use the terms as you will, but like kind of distinguish them, maybe.
They seem like, in extent, like interchangeable. Like it seems that the effect is still similar. It's about a neurological disease that causes one to want to get rid of their limb. Would it make a difference if it's for identity or like sexual gratification?
Um, so I would say that identity can sometimes be a matter of sexual gratification. So
Hmm.
they are sort of bound up with one another. I can dispense with sort of being
Yeah,
precise here.
let's take it for granted that they're interchangeable, or would that make an issue?
No, no, that should be fine. I think if
Okay,
you want to
great.
argue from that point of view, if there's an issue, I'll bring it up.
Mhm. The disease itself is very recent. It was only added to the ICD, which is the International Classification of Diseases. It's a diagnostic tool used globally by the World Health Organization in June of 2018. As such, the empirical data behind the disease are not that substantial, and it would lead me to be unsure of making a strong positive claims to something like gender reassignment surgery because there's huge meta-analyses done on the topic that can easily lead us to is it positive or negative. Um, so the lack of empirical data makes the idea a little bit more muddied than I would like to, but still I can see a case being made for it being positive. Then we'd have to argue about the ethics of the amputation itself rather than deferring to any empirical data to substantiate our claims. Does that make sense?
Yeah, yeah,
Hmm.
absolutely. Yeah, I'm
Hmm.
following your. Yeah.
So, my case is more of an agnosticism that leans toward a positive claim. So far, there had been cases, and a substantial number of those cases, where amputation actually led to a positive result. However, other cases had the positive results with dialectical behavior therapy alongside medication. But I'm still hanging on to that positivity in it. And
Sure,
I would
sure,
like to hear your case against um, amputation.
sure. So again, yeah, I mean, I think this may be a debate of two uh, reasonable people coming to almost the same, but sort of making the stance, but then sort of making a slight distinction here. So I too agree that the case, this is a new phenomena. We do not really know the benefits. It seems from my research that about 70% of amputations on these people are
Mm,
effective at removing their symptoms uh, of discomfort and body
mm,
sort of being uncomfortable in their own bodies. Um, so a 70% rate
mm,
is, in my view, I guess, not good enough to justify this. So, in a purely libertarian world, I would say, like, you know, do you. You got to just do you. But when it comes to medical procedures, I think doctors take a Hippocratic oath, and that Hippocratic oath will necessitate them sort of ethically to do the right thing by their patients. And one of the key factors, although it doesn't say this in these terms, it's in the Hippocratic Oath, the idea that uh, you must first do no harm to your patients. So before you attempt to heal them, you must first make sure that what you're doing is not going to hurt them in some way. And we know, you know, simply by how it works, like removing a healthy limb is a form of harm. Um, now, I think I think we can sort of draw maybe a comparison here with something like anorexia, right? In in that case, the patient has a body image that is out of whack with reality, right? They perceive themselves to be overweight when they're probably dangerously underweight, right? And because, it's going to cause them quite like harm to pursue this image, right? We need to, try to use therapy and perhaps drugs to, medicate this person, to give them, a chance of success and a chance of overcoming this issue. Now, I think in a similar case, there are effective remedies with cognitive behavioral therapy and antidepressants to treat these issues around people who don't have limbs, or sorry, who want to not have limbs. Um, I would advise these things over the more radical treatment, just in the case of when we don't know the whole story. And so far, amputation only really has a 70% rate, right? We can think of, people who get plastic surgery to change their face, right? Um, there are those, most people, I guess, are fine to get plastic surgery, right? They did never like their nose as a kid, or they have a weak chin, or whatever insecurity, they're able to change it and feel okay. But there are those people who have sort of like, the insecurities on the inside. The way they're looking at themselves is actually the problem. And for those people, plastic surgery can often be like incredibly dangerous, right? Or destructive. You can look at like, Michael Jackson and what he did to himself, right? Um, and in those cases, I think to provide those services is actually in violation of the Hippocratic Oath.
mm. Okay. So when it comes to the Hippocratic Oath and do no harm, how can we pragmatically affect that like moral injunction? Because, for example, we have open heart surgeries where we have to open the chests of our patients to replace their hearts. Aren't we technically causing harm so that we could
No,
alleviate more harm?
no. The idea is not like, you should never engage in anything,
Mm,
any sort of preventative measures or any surgery or anything like that. The
mm,
idea is that you must make sure the surgery you're doing is not going to cause the patient harm, right? There,
mm,
there may be some risks, and it does come down to a risk management, right? You want to make
mm,
sure there are the most benefits and the least amount of risks. But you can't engage in something that has the ends of harm, and it would cause a certain amount of harm recklessly in order to um, where that benefit analysis has not been done, right? We both admitted that
Hmm.
this is new. We both admitted
Yeah.
there are other treatments, and that 70% success
Well,
rate
yeah,
is not
because of like
that high.
there aren't many cases for us to study and be able to substantiate the percentage and which cases need an amputation because there has been people with BIID that are they are satisfied with just pretending to be amputees in their private space. They pretend to only have one arm or one leg and walk with crutches and so on. And definitely there has to be more studies done on that end. But the problem is like the idea is to maximize happiness when it comes to medicine, or would we differ on that? People heal so that they could feel better about themselves. It's not about like when I have a cold, it's not that my identity is lacking or anything. I just want the cold to go away so that I could improve my general being or like the quality of my life.
Hmm.
Same thing with gender reassignment surgery. Um, and when it comes to BIID, people are not satisfied. Like they become suicidal, they're depressed, they ask for that amputation, they feel like they can't live their lives without the amputation. Aren't we minimizing the harm in that case?
Um, I would say yes if amputations were more successful in treating this. I think that
Hmm.
if we can find just as successful, because 70% is not, I would say, a high enough rate to where, um, like if you just really want your foot cut off, right? And
Hmm.
then you have your foot cut off, and then you don't feel satisfied with that. And then you're like, wait, no, I actually want my I want my lower leg cut off. And then, where does it end, right? If it's going to solve the problem and you like lose the foot, you're good. You have a robot foot now, and you can just forget about it, move on with your life. I think you'd have a very good argument. But
So, like to avoid a Socrates paradox, which would be the percentage that you find good to say that let's implement this type of therapy or treatment?
um, so what percentage? I would say like approaching 90% or something. I would say like if I think you need to get higher than a mere 70%. I think, you
Does that
know,
seem a little bit arbitrary?
it probably might be.
Hmm.
And we're sort of talking sort of like ballpark numbers here, but I think the point here is not arbitrary when you're weighing risk and reward, right? So that's,
Hmm.
as a doctor or whatever, we've taken the Hippocratic oath, we're weighing this idea of, do we have the potential benefits, we have the risks, and we have the certain sort of negatives of losing a limb, right? So there
Mm.
are all the risks of like the surgery, right? It could go wrong. You could, bleed out, like you could potentially die if you have your leg removed, right? Um, so there are all these risks that you have to weigh against the benefits, and then you also have to weigh, the sort of the downside of like not having a
Wait, is
leg, right?
there like a data done on the failure of amputation or the success rates of amputation? Is it really that dangerous to cause like
Um,
a 10% mortality rate?
yeah, sure. Let me
Yeah,
find that. We can,
take your time.
yeah, I'll do that. So I would say, while I find that though, that
If you are like, I'm going to use another example to compare to BIID, the cases of frostbite. They're always amputated, if I'm not mistaken.
okay.
What distinguishes frostbite from BIID?
Ooh. So at least 41% of people who get amputated have to go at least one more amputation. Ugh.
Hmm.
So that's like not a good. That doesn't seem fun.
But
Um,
why are they being amputated?
so the there's a post-operative infection rate ranging from 12 to
Mm,
70%
mm,
in the UK. Um, I'm not like a doctor or an expert, but I
mm,
would say that there are serious risks and complications with like having. Oh God, just looked at a bunch of stumps and that was
mm.
gross. Um, yeah, there are serious complications here with with
Mm.
serious risks of complication here. I would say.
I would have to look at if these amputations are because of other risk factors like diabetes or frostbite or
Ooh, I
accidents.
do have factors affecting the lifespan following below knee amputation in diabetic
Mm,
patients. I have a study right
mm,
here. Um, so there are even more problems. Yes, if you're diabetic and you have an amputation.
mm. And this is what I said when the data is like lacking. Do we have voluntary healthy amputations and what are their percentages of post-infection and so on?
Hmm. Yeah, no, I agree the data is lacking, but
Mm,
in such cases, I think we do need to illustrate a certain amount of restraint, right?
mhm,
So I think what it like to get sort of maybe philosophical for a moment. Um, what is at play here is maybe a difference between the modern conception and a more sort of ancient conception of sort of ethics. The ancient conception is that you go along with the cart. If there's a problem in the world and yourself, you sort of change yourself. You work on yourself and you kind of like go along with it. The modern
mm,
idea is that no, we can actually change the world and we don't need to be limited by it. If I, don't like my nose, hell, I'll get a doctor and he'll make me a new nose, right? And we can, I don't need to accept the things. I don't need to work on myself. But I
mm,
think I think each side here is lacking something, and that we can't, in our modern conception, forget about this ancient wisdom that would say, like, let us look inwards. Let's tell ourselves, like, this is a bad feeling that I'm experiencing, but perhaps I can through therapy, through um, various things, attempt to resolve these issues.
mm,
Um, because to a certain extent, we all have a bit of incongruity with our bodies, right? When we
mm,
look in the mirror, you know, that thing there is like, it's not us necessarily. It feels like it is us, but it also, there's a sort of a disjunction there. And, you know, should we all, if we look in the mirror, we should seek to change the things that we can change, but we shouldn't attempt to do harm, like when it becomes like an anorexia, when it becomes a sort of a form of self-harm. If we're not looking at ourselves properly, then there's real danger there, right?
mm. And I completely agree here. And I could even overly complicate this issue even more. Like I could be Heideggerian about it and say, how can we really distinguish between the inherent and the external? Like for example, if black people suddenly wanted to do surgeries to change their skin, they want to be white. Would that be ethical? And can we really say that this is an intrinsic bodily dysmorphia or much more of an external racist beliefs that they internalized? And how can we distinguish between both of them?
Sure. And that absolutely exists, right? With like skin
Mm.
whitening creams, right? And
Yeah,
the way
Fair and
those are.
Lovely, and in India, that's an entire problem with the beauty industry there.
Yeah, exactly. Yeah, that's a whole interesting um sort of road to go down. But I would agree that these things can't be separated from their cultural uh, exist, sort of their cultural nook that they have
Mm,
found themselves. That these things like aptotemnophilia were incredibly rare, and until the internet came along, right? When you look at these there's a whole web subculture out there, and in my research
mm,
I sort of discovered this, that there really is sort of like a whole subculture, so like maybe like flat earthers or like any internet subculture.
Did the
Um,
internet create them or cause them to be
So
able
I think they've
to,
found each other, right, to a
yeah,
certain extent, but there
exposure.
is a sort of weird, well, not weird, not to judge. So there is
Hmm.
a interesting cycle there. So there are people who are sexually attracted to amputees, okay?
Hmm.
And then there are these people who are what are called wannabes. This is
Hmm.
not my term, who are essentially apotemnophiles, right?
They
They
pretend to be.
they really want to be amputees, right?
Hmm.
So there is a certain sense that there's like they are looking for love from the amputee lovers, essentially, right? And there
Hmm.
is like this cyclical relationship here where they will do more and more amputee-esque things to please their amputee lover online BFs, right? So, you know, I agree that, there is like a whole argument like how much do these people just exist and are finding out about it, and how much
Hmm.
is being sort of created by it. But we do need to, I think, take seriously the fact that the internet does create these things. It does open up a space for them.
I'm afraid of going through the same road because I feel like this argument could be used for a lot of like LGBT sexualities.
Hmm. So I think, so I think, in terms of how that argument would be used, I think that
Uh,
these like people are created always by their cultural environment, by the
mhm.
terms they use. So, in some sense, giving people these terms and our acceptance of this has led to these people just, being free to exist instead of hiding, right? But on the other hand, people aren't set in stone, right?
Mm,
And when you give people these options, they will maybe choose these options, right? Whereas
mm,
before they wouldn't, right? And I wouldn't say there's anything wrong with being like an LGBT, like, right? That's incredibly good. And, you just have to do what you want to do, right? That should be
mhm.
an option within our society. But when it comes to matters of sort of like radical self harm, we should maybe see if there are other better ways first before we go through. We say this is like the route that we need to go down. And I think we both agree like the evidence just isn't in yet. We
Yeah,
can't say like,
I'm not for saying, oh, let's legalize it tomorrow. It's the fact that we could may take incremental steps towards legalizing it eventually
hmm, okay,
through actually studying it much better. Because I think there are people, we said that 70% of them are satisfied, and that's a substantial number. Let's understand why those 70% are feel positively about it. We didn't get into the harms of people who engage in self amputation and the dangers of that. You're responsible for these people, you know?
sure. No, I do agree that we do need to mitigate for the harms of people trying to amputate their own limbs, right?
Hmm.
The question is performing those amputations as a medical professional going to be the way that we solve that problem? I think that if we can get to a place where people sort of self-report and are like, okay, I'm feeling like I want to amputate my own limb, right? They go to see like a doctor, we have healthcare professionals, then we can look at all the range of treatments, right? And I think ultimately, like, yeah, more research needs to be done. So I I guess you need to, I guess, show that, you know, perhaps we need to wait and see what the research is, but now, as of now, I don't think we can say this is a good thing that we should be
Mm,
that doctors are morally justified in committing this
I would have
in doing this
agreed
research.
on this point when it comes to self reporting, had it been a purely psychological phenomena. There have been many arguments that it is a neurological disease. It's not really like contingent upon culture or beliefs. It's something that is in your body.
Oh, so I actually don't think the research again is all in on this
It's not
because
conclusive, and I
right
agree on
because
that.
although there are changes in your brain, right, that we can see in these
Mm,
people, we don't know whether these changes have been actually created in the mind by their own subjective experience, by um, doing things like tying up their limbs, not using them, thinking all the time about not having a limb, right? We don't know if, in fact, this kind of paraphilia would actually just cause a change in the brain in that form.
mm.
So I do agree, but it is sort of like a chicken in front of, or a chicken or the egg problem
Yeah,
here.
it's very, very blurred. It straddles but the boundaries between neurology and like psychiatry.
I agree. Um,
Mm,
and I think, we can look into it. And
mm,
I would, as a matter of empathy, right, for these people. Um, but certainly these online communities are very, from the outside, they appear to be, it's all filled with, pictures of amputations and, instructions on how to self amputate and sort of this encouragement of amputation
mm,
of one group of wannabes by this other group of
hmm.
amputee lovers. And to me, that does not seem healthy, right?
True, and I
In
agree.
a healthy sense. So
We
if
need
you
to.
are being
Mm,
sort of lured or encouraged down this path, and like you want someone to love you, and you found this person, and okay, you're doing your thing, but I would say um, for a doctor to get involved, certainly, you know, I would not think that I think the doctor would have a duty to report this, like to get this person the help that they need, right? And the help that they need, I would say, is not this amputation. It would be, you know, CBD, like a CBT rather,
mm,
this cognitive behavioral therapy, which has some success in treating this, as well as
hmm.
antidepressants. They prescribe antidepressants for this. Um,
Hmm.
and I do agree there is no agreed upon medical treatment for this
Yet.
yet, but because of that, we need to err on the side of caution, I think.
Yeah,
Um,
true. But my argument here would be to err on the side of radicalism because you want to facilitate mainstream conversation and easier acceptance of this kind of disease. And you said it yourself, they hide away at the corners of the internet and propagate between themselves inside an echo chamber. Why not make it much more mainstream? Let's talk about it, let's see it. I think having those group feel that they could be accepted, hinting at a chance that, oh, we could legalize amputations for this specific disease, BIID or whatever name it is given, would facilitate and like an understanding with these groups. Like usually they are shamed. They're as I have looked into it, a lot of people treat them and marginalize them. This would harm both their self-reporting and how we could actually look into this syndrome and treat it.
so I I think that there is I think that empathy is always a good motivating factor, right?
Hmm.
And I think people should never be like shamed for their kinks or the way they identify themselves. I don't think we should, they're no matter how out of abnormal, I don't think there's anything um, that doesn't give you license to act in a negative way towards someone in any way. Um,
Hmm.
but
I'm
I
sorry, your
think
voice is
I
is cutting off a little bit. You're roboting.
am I?
Yeah, for a few seconds there.
Oh no. So I would so hopefully I'm back. So I
Oh yeah,
would
that's good.
okay. So I would look to this article in the Atlantic that I think Frozen Broccoli pointed me towards, um, and sort of this question that they raise at the end of it. So we don't know, I guess, to the extent to which these things are socially created. by things like accepting them,
Hmm.
and uh, things that were sort of hiding there all along that we've refused to acknowledge and now are just coming forward. I
Hmm.
think I think, the article remains ambiguous and sort of non-committed to which one of these things it is going around.
Hmm.
But I think the danger here is that in normalizing these things, that more people will choose it because people are
Again, we're
essentially
back
like,
into the
right.
anti-LGBT
No,
arguments.
this isn't anti-LGBT because there's nothing wrong with someone wanting to be trans and choosing to be trans, right? That would just be 100% okay, right? Because there's no
Hmm.
harm in being trans. But,
True.
wanting to be, to have no limb, that actually would produce, it's quite dangerous. It would provide some harms, I think, right?
So
Wouldn't it?
here's where we disagree on harm. I value more the mental well-being of individuals rather than their physical, quote unquote, health, how healthy they are.
Sure, I would agree with that. But the thing is that if you just let them cut off the limb and then they want to cut off more limbs or cut off that limb further down, right? If it were a matter of like snapping your fingers and making their mental problems go away and like trading, years of good health and sort of mental health for like, I don't know, your foot or
Hmm.
something, um, then that would be one thing, right? But that's not how these issues work, right?
Hmm.
That maybe in some of the cases, the majority, like in a small majority of the cases, that's how they work. But there's a large minority of those cases where this treatment is actually going to be ineffective and that they're going to require maybe more amputations after that,
Wait,
right?
a large minority?
Yeah, I would say that like 30% of people would be like who if 70% are effective, right? Then
Hmm.
30% of people they're ineffective. And that means you've like had this amputation and your symptoms didn't go away. Now you like are craving more amputations. That seems like, what do we then continue to amputate until the symptoms go away? That seems, again, I think the wrong approach, right?
But aren't people free to do whatever they want with their bodies? Like we're talking about their mental well-being. If I could like chop off all my limbs and I'm extremely satisfied, unlike
Um,
being with healthy, able body but extremely depressed
right. So like a case of like suicide or something like that.
and
Um,
self-harm or even attempting self-mutilation or like self-amputation.
right. I would say that um, doctors might have an obligation to help someone who's in, like has like a fatal disease or something is just going to suffer.
Mm.
They might have the obligation to help someone like that, but they wouldn't have the obligation to kill like a normal and otherwise normal and healthy individual who just simply wanted to die. I don't think we've really reached that point within our society. Ultimately, what you do to yourself is, you know, you're free
So
to do
what
it,
do you
but I think you
constitute
can
a
do self harms, right? Like for example,
mm,
if you smoke or something, right? That's sort of a harm you're doing to yourself. Um, it might be pleasurable at the time, debatably, but at the end of your life when you're hacking up, black chunks and you're, wheezing all the time, you're on a ventilator. Oh yeah, 420, blaze it. You're going to be, regretting that decision. You did a harm to yourself. That was wrong of you. Oops. Right. So, like at the time, you're really wanting to cut off your limbs. You think that, like, oh, this is going to be good and beneficial. This is going to get rid of my problem. You see a doctor,
mm,
he's like very compassionate. He's like, well, I guess this is the only way. So he does it. But then, oh no, this didn't get rid of your problem. Now you need another amputation. You find another doctor pretty soon. you're running out of limbs, you're significantly disabled and impaired, and perhaps you haven't even solved the issue that you're trying to solve, right? And
Mm-hmm.
so you've sort of ended up in quite a negative place, I would say, aided by these doctors. So I would say that these doctors would need to examine the Hippocratic Oath, examine the
Has
dictum
there been
to
a case like this, the one you just mentioned, where an individual had cut off like all their limbs and they were still unsatisfied?
um, so I would say in 30% of cases, someone did cut off a limb and was not satisfied.
And what was his satisfaction rate afterwards? Did he cut another limb and become satisfied or not?
Um, According to I'm not sure on this research. My research just said that 70% were satisfied,
Hmm.
but
So
only
we can't assume like this is only about the initial amputation,
um
correct?
it seemed like it was speaking about all amputations. So maybe these people have had multiple amputations. Maybe you get to roll the dice 70% every time. I'm not sure how it works. Right? The thing is we don't
Yeah,
know.
so
So
can
let's
we
not
safely assume that we should avoid a slippery slope, correct?
um yeah, let's avoid a slippery slope.
Mm.
Slippery slopes are fallacies. Yeah.
Mm. And
So
again, like let's say, okay, so um, what percentage would you be satisfied with after a second amputation? Let's say out of those 30%, how many percent of them would be satisfied with a second amputation? Like they cut off their leg and then their right leg.
sure, you're
W-
you're asking me for data, right? But the thing is,
Yeah, and there
you
aren't a lot of data.
but you're making the positive claim, right? So you
Hmm.
need to show me some data that says that okay, the first surgery wasn't successful, but then after that, it's like all good or whatever.
Yeah,
Or
yeah, we keep arguing on the 70%. I think 70 is a substantial number, and you think that 70 is not a substantial number, and we're both using arbitrary terms here. Like
uh,
maybe I could do the same argument for 50.1%. I say, oh, this is much more than 50%. It means that the majority are satisfied.
right, but I'm saying like we need to advocate in our policies, which are for everyone, for
Mm,
like very substantial minority of people, right? You
mm,
wouldn't prescribe a drug for if it was only 70% effective if there were very negative uh, health outcomes for everyone else, right? Or at least you do
mm,
so, very, very carefully.
mm,
Um, right. So I think in a similar way, we do need to, take these very serious risks into account before we act
mm,
in a medical sense. So I do agree it is arbitrary, like 70%, like, oh, but but my point is there's a very sizable minority of people who are going to be negatively impacted by what is going to become policy for everyone. So
mm,
we do need to advocate for their well-being as well. um yeah, does
mm.
that make sense? Does that kind of close?
Yeah, that makes sense. I think, yeah, our arguments hinges on the data, unfortunately. So now we're just mostly just presupposing and making assumptions at this point.
Sure.
Um, so, oh, 1 minute left. Okay, you could go ahead with your closing statement. You start. I had the initial opening statement.
Okay, yeah, I mean, I don't mind. So here's my argument. I think that doctors take a Hippocratic oath that they must be incredibly careful with the harms that they engage with. They must first do no harm before they, look to the benefit of these patients. So you must make sure that you're not doing something that's going to severely negatively impact someone. I'd put it to you that losing a limb is actually a severe harm. Even if you desire that limb to be removed, you think you desire that limb to be removed, in a very substantial minority of cases, these patients still feel this is inadequate, and they're left with no limb. I think that this is unconscionably risky for the doctor to engage in. I think that
Your
any reading of the
voice cut off,
Hippocratic Oath.
and the past sentence was completely robotic.
Oh no, my internet. I
Oh
don't
yeah, it's good
understand.
now.
All right. So I said that this is an unconscionably risky behavior, sort of for doctors to engage in. Um, if a very sizable minority of people are going to have a very negative outcome, then they can't reasonably require this as a universal treatment, or as a treatment. Full stop. I think we need to look at these conceptions within our own society about changing something that we're unhappy with in the world versus changing ourselves. I think both the Stoic and the modern conception that I sort of tried to outline are in some way inadequate, that we do need to take each into account, that we cannot simply change something in the world and expect an internal change to follow from that. That would be something that we can't know, and that there are real harms done by excessive like plastic surgery, by
Hmm.
things like anorexia, um, and that we as doctors or as followers of the Hippocratic Oath must act against. I think we can look at the creation and spread of things like maybe like flat Earth on the internet. I think these unhealthy web subcultures do create these things that, although there are maybe some people who have this feeling, there may be some neurology. It could be that these neurological findings are actually created by the very society that these people live in, that their desire for love pushes them to want amputation because of the amputee fetish that their internet lover has. Um, and in these cases, we have to look at the human heart and see sort of the weakness there, and sort of say, okay, I think we need to not facilitate this amputation, even though you want it for your lover or yourself, or in a way to sort of sexualize your identity. Um, I think we need to treat these people with compassion through proven methods like CBT and antidepressants, give them care, and perhaps, like, perhaps that includes pretending to not have a limb, something like that. But I think to engage in a very risky behavior, as I said, so like a very risky endeavor to remove this limb, I think it's a step too far. That it leads to the over medicalization of this issue, and we ought not. We ought not do that.
Hmm.
Yeah, thanks so much.
No, you're welcome. So initially we talked about the Hippocratic Oath, and in my opinion, I could agree with Jacob due to the lack of the data. I can't support the positive claim that yes, amputation will lead towards a increase in the quality or the quality of life of the individuals with the syndrome. Only when there are enough empirical proofs, I'll be able to accurately and confidently make that statement. So we are still agnostic, despite the fact that there are good initial outcomes. Again, we said 70%, that's a substantial number, despite being somewhat arbitrary. Unfortunately, I couldn't ask my interlocutor what a healthy individual is, because this is a very slippery concept. Being LGBT was not considered healthy. Being trans was not healthy. Being gay was not healthy. How do we constitute health in this debate? Which is a very interesting topic we could discuss later on. Um, my interlocutor had also mentioned stoicism and knowing your own heart. And I disagree on that point. I'm going to have to be a Heideggerian. We can't really make a good distinction between the inside and the outside, the world and the self. It's not as clear cut as it is like an object and a subject. Where do our desires come from? Is it from the outside or is it from the inside? Like Lacanian psychoanalysis helps us understand this. And this is why I advocate for being open minded and having this option on the table. It would allow to people to be able to express those desires, talk to them easily, talk about them easily, facilitate more data collection, and reach a better and more accurate consensus on how to move forward. And thank you very much.